vaginal hormones, vaginal estrogen or vaginal DHEA, which we just showed a bunch of, prevent UTIs by more than half. And this little tablet, so instead of a cream, you could just put this little tablet in twice a week, and that does the same thing as the cream.
Ah, okay.
Okay, so it's a little less messy. So people tend to like the creams better. Now, if you really don't want to do anything twice a week, this is a ring that goes in the vagina and it can stay in there for 3 months. Now, it's sort of like a tampon. You can kind of put it in the vagina and the vagina does not feel it. By the way, the vagina is not very sensitive in terms of nerve endings. And so when women put tampons in, they don't feel them. When you put this ring in, that you wouldn't feel it either, and it would stay in for 3 months at a time.
And there's a chemical inside this ring that's going to diffuse
estradiol
out.
that slowly diffuses estrogen for the ring. So that's nice for women who have dementia, who have very bad dexterity with their fingers. They're in a nursing home. For someone who's on the go and they can't remember something twice a week. So our ADHD patients like things like that. Now, the one different one, this is something called DHEA. Now, DHEA is the precursor hormone to estrogen and testosterone. And remember, I said the vulva, the vagina, the bladder need
What's a
testosterone
precursor?
too. So this is a chemical that converts into estrogen and testosterone. And so DHEA is a supplement you can buy, sort of in the supplement aisle. But if you put it locally in the vagina, this is an FDA approved product. It's called Intrarosa. And if you just put this in the vagina, it's meant for every night, but you can do it twice a week. It melts at bedtime when you wake up, and it prevents UTIs. It helps with pain with sex.
And just to be clear again, so you think a lot of people should be taking these things?
I believe it's preventative. So I think, and we wrote guidelines by the American Urologic Association, why this is so important, how to do it. So many women have symptoms of urinary frequency, urgency, leakage, urinary tract infections, pain with sex, dryness. And this is a safe option for all of those women. So women get urinary tract infections a lot. And so what do we tell women? Pee after sex, wipe from front to back. That's not data driven, by the way. That's all a folk tale. That's folklore. There is some data that cranberry pills can help with preventing UTIs, but the amount that you'd have to drink is very sugary and diabetes inducing, and it wouldn't taste that good. And so they do make pills, but these things are small things that help. Drinking lots of water can help. But vaginal hormones, vaginal estrogen or vaginal DHEA, which we just showed a bunch of, prevent UTIs by more than half. They don't just prevent UTIs, they help with urinary frequency, urgency, leakage, pain with sex. They help your arousal, they help your orgasm, and they're safe for every age with every medical problem.